Welcome to eHealth Learning, inspiring professionals worldwide.
So what is spinal cord compression? Well, it's compression of the spinal cord above L2, or for the peripheral nerves it's called cauda equina. Most of it is extrinsic compression of the cord due to a bony lesion or a soft tissue lesion. I haven't really come across it as being an internal one in practice myself, but there could be an abscess or there could be hemorrhage. There could be a herniated disc, or occasionally there might be a mass, but I haven't come across that myself. It happens much more commonly than you might think. So I'm not wanting to raise people's fear factors after the previous presentation, but if you're just aware of these things in your head, you might have the instinct that actually what's presenting to you isn't what you were anticipating. Or the other situation that might arise is that somebody before you may have talked to the patient or the relative that they are at risk of these conditions, and actually they may not have completely understood what they're talking about and want you to explain it again. So that's the other situation. So spinal cord compression, it occurs in 5 to 10% of all cancers. So that's quite high, really. Commonly, the people most at risk are breast, lung and prostate cancer and myeloma, but less commonly from rectal cancers and pelvic tumours. And 20% of these people have spinal cord compression at more than one level. So I think we have to be a little bit careful of knowing where we're working in terms of Bowen treatments and what might be happening underneath in the tissue. The clinical features, pain is the number one thing. Of course, we have lots of people who come to us for Bowen treatment with back pain. And pain often presents maybe a week or two before the other symptoms, and may be quite a serious precursor for what's going to happen. Weakness, so somebody might complain that they're not feeling they've got the strength that they normally have. They might have a change in sensation of the limbs. And the sphincter dysfunction, they might have problems with their bladder or their bowel. So these would be common questions that I would ask people with back pain, whatever they come with. Do you have any numbness, any change of sensation? If so, where? And particularly if they've had any bladder or bowel problems associated with that numbness, I'd want to know a little bit more about what was going on there. So the signs that people have, as I say, it's weakness, changes in their reflexes. If you have the skills to be able to do a neurological examination, that can be really helpful in giving feedback to the medics. The numbness that's there, the sensory loss, the urinary hesitancy, and the bowel problems that people have. Obviously, the last two symptoms, you'd hope that they would have contacted their GP or their oncologist by that stage. But that isn't always the case. You might be that one person who they really connect with and that they feel they can tell you anything, and in nursing that's often the case, that they will have seen someone but they don't tell them the whole story, and they want that supportive person. So ask yourself, is there a reasonable likelihood that this patient is having spinal cord compression? So that would be going on their past medical history and the symptoms and the signs that they're presenting to you. And if so, would they benefit from emergency investigations and treatment? Because I am here talking about emergencies as well.